this polio vaccination, as important as it is, it's essentially like going into like Auschwitz in the midst of the Holocaust and being like, well, we're not going to stop the death camp, but we're going to go in and vaccinate everybody so that they don't cause a problem for the rest of the world.
Yeah, and knowing that they are all condemned to die. Yes, knowing that they all condemned to die, like you have to die from these causes, but not the other causes.
Yeah, because these causes are a threat. Yeah, these causes are a threat to everyone else. It's really sickening.
And Israel's policy in Gaza is to make sure to destroy and to worsen every social determinant of health possible. The effect of this crime are going to stretch out, over time. It's not just an instantaneous problem, but it's going to be a problem for life.
And this is also, I mean, you're talking about people being paralyzed for life, and this is in addition to so many disabilities that people in Gaza are going to have. Hello, everyone. I'm Rania Khalek, and this is Dispatches. Israel isn't only murdering Palestinians with airstrikes, shells, torture, rape, and bullets, but also with disease. In the past 11 months, Israel has targeted hospitals and doctors and sanitation and generators. It's cut off water and food and electricity while displacing Palestinians in Gaza dozens of times over, forcing them to run for cover from one overcrowded tent camp to the next. This has created a public health emergency that's led to the reemergence of polio, which causes paralysis in young children and had been nearly eradicated globally. To discuss this and more, I'm joined by Lebanese medical doctor and public health researcher Anis Germani. But before we jump into it, this is just part of this episode. The full interview is available to Breakthrough News members only. You can become a member at patreon.com/Breakthrough News. And as always, be sure to hit the subscribe button and the bell so you get a notification whenever we post new content. And if you appreciate this show, you can also donate below on YouTube. Anis, welcome back to the show.
Thank you, Rania. It's good to be back.
Well, I wish it was under better circumstances because I have you back on to follow up to our last discussion, which is about the way that Israel was using disease basically as a weapon, creating a public health emergency in Gaza, in addition to all the other tools it's used to carry out its genocide. And now what we've seen unfold over the last several weeks is the reemergence of polio, which took, it took some people by surprise just because this is something that was eradicated, decades ago, especially in Gaza. Had almost been eradicated globally. And now you have a reemergence of it in a place like Gaza, where you have actual cases now of children being paralyzed. So, I think a good place to start would be, can you give a little bit of background, but in layman's terms, to just explain to our audience, what is polio? Because I think for a lot of people, this is a vaccine we get when we're babies, basically. We don't think anything of it because this is not something that particularly impacts most people in 2024.
Yeah. So, the thing about polio is that it is, first of all, a virus. It is transmitted mostly through water. It is a virus that enters through the gut, so the gastrointestinal tract, and it is through there that then it is excreted as well. So this is how the mismanagement of sewage, or whether if people are exposed to sewage, they are exposed as well to the virus. This virus causes classical viral symptoms, but the dangerous part of polio is that it can cause something called acute flaccid paralysis. So it is, in a sense, immediate paralysis that starts most of the time in the legs. And I think the best example, the most famous example, is FDR, who was paralyzed because of polio as a child. So over the decades, there were a lot of concentrated efforts to eradicate polio. Polio comes in 3 different types. They all cause the same disease, but they are called type 1, 2, and 3. So far, the types 2 and 3 were completely eradicated, and I'm talking about the wild type. So in terms of viruses and vaccines, the wild type is the one that we found naturally, and there are other types that are created for the sake of vaccination. So the wild type 2 and 3 were completely eradicated. So type 2 was declared eradicated in 2015 by WHO, and type 3 in 2019. However, type 1 was not eradicated. It still exists in Afghanistan and in Pakistan. If we're going back to what's happening in Gaza, it is no surprise. Like what's happening today is no surprise. I mean, we've already discussed this, you and I, and the other experts as well. There is an active policy to promote the spread of infectious diseases across Gaza, as expressed by the retired Israeli general Giora Eiland. He said that we should allow and promote the spread of diseases to be able to win the war with the least amount of Israeli casualties. And in a sick, it was like a whole op-ed that he wrote. And like when Hamas looks at their kids and they're dying, then they will surrender. So yeah, this is not a surprise. There's also like another report that was published by it was a joint report by two highly reputable international universities. So the Johns Hopkins University and the London School for Hygiene and Tropical Medicine, and they said back in February they were trying to project how many preventable deaths would happen, and they said in their report that it would definitely be because of infectious diseases, and they singled out specific germs, which are measles, meningitis, cholera, and polio specifically. So it is not something that was expected.
Yeah, and I think it's especially troubling. Not that any other disease that's this bad would be like better, but when it comes to polio specifically, I mean, you and I were talking before recording about the fact that this is actually the disease that started the entire science behind vaccines. So it's just particularly stunning to see this disease be the one that reemerges. Can you talk just a little bit about that and the significance here?
Yeah, so the thing that is special about polio is that it was able to galvanize international collaboration in order to eradicate this virus. There is something called the Global Polio Eradication Initiative. It is a coalition of multiple countries. Most countries in the world are part of it, and they set specific goals to completely eradicate polio. So one of the setbacks that did happen starting in 2015 was that the moment that the wild type 2 vaccine was eradicated, type 2 virus was eradicated, it was also removed from the vaccines. So the usual vaccines, that there are two types of vaccines. There are the ones that are injectable and the ones that are oral. The ones that are injectable do not prevent transmission. However, they do prevent the development of the neurological consequences of polio. So people will not go paralyzed once they have this injection. However, it is not practical. So especially in poorer countries with poor sanitation, it is easier to give the other vaccine that is it's in drop form. So it has to be cooled, but they're just a drop that is given on the tongue of children, 2 doses, 1 month apart. So the thing is, and the oral vaccine that is the drop form, these are attenuated live viruses. So it is a virus that is functional, but is not infectious. So it cannot cause all of these negative consequences on human beings. And they spread through the GI tract into sewage. So and then it can also vaccinate by proxy other people as well, especially in areas and countries where there is poor sanitation. So just in the same way as they would have been infected by polio through the sewage system, they can also be vaccinated by contracting the attenuated version of the virus. However, some problems also arise from it, and this is also this is not a secret. Sometimes in poorly vaccinated populations, mostly the virus that is attenuated and is used in the vaccine can regain function. It can be as bad as it was before. It can undo the mutations that were done in order for it to be, a mild form of the virus. This became a problem, especially following 2015, when the Global Polio Eradication Initiative removed the type 2 from its vaccine. So usually the job of vaccine contained the type 1, 2, and 3. And since they declared the type 2 was eradicated, they removed it from the vaccine because they were afraid of reintroducing it into communities again through this process of mutations and gaining of function once more. The problem arose when there were multiple outbreaks that started happening after 2-3 years after. So starting 2018 approximately, there were outbreaks that started to happen, especially in areas that were already poorly vaccinated. We're talking mostly about sub-Saharan Africa. There were multiple outbreaks of type 2, of the vaccine-derived type 2 polio. And this is the same thing that's happening in Gaza today. So the same strain of polio that is present today in Gaza was detected in late 2023 in Egypt. So now we can trace its source back to Egypt, and it is derived from the vaccine. However, I have already seen Israeli news media outlets saying that the outbreak of polio in Gaza is blamed specifically on the WHO and on this decision by the Global Polio Eradication Initiative to remove the type 2 vaccine. But this is not the entire story. Because the type 2 outbreak in Gaza would have never happened were there not a genocide going on. So no, it is not purely a failure of science, but it is also definitely because of the genocide that is happening in Gaza. It would not have happened were it not for the genocide.
So can you elaborate a bit on that? Because that's really, really important. I mean, obviously there's other factors that you just mentioned, but break down how over the last 11 months, the things that Israel has done to basically dismantle Gaza's public health infrastructure and also create conditions that are just, that are basically great conditions for diseases to thrive in order for something like polio to reemerge.
Yeah. So I think that we're going to echo a lot of the things that we said in the previous interview, because it is the same thing that's continuing to happen. Right. Nothing has changed. It's only getting worse. So there is something called the social determinants of health. And these are the circumstances in which you live that determine whether you fall sick or not. And Israel's policy in Gaza is to make sure to destroy and to worsen every social determinant of health possible. 11 months into the genocide, already there's only 44% of hospitals that are partly functional, 44% of primary care clinics that are also partly functional. They've destroyed water, water infrastructure, sanitation. The deprivation from food is also a big problem because weaker bodies are less able to fight off infections, and they also cause huge inflation in Gaza. And the products the Israeli products that are sold in Gaza are now extremely unaffordable. I have a list right here, and if you take just a quick look, you see how insane it is. So like a carton of eggs costs around $74. 1 kilogram of tomatoes, $54. 1 kilogram of powdered milk, $46. A bag of diapers, $80. So this is how people are living in Gaza. It's insane. The prices are insane, and this is entirely caused because of the siege and the prohibition of entry of aid into Gaza and the actual genocide. So when you have sewage water running down the streets, and then people are being displaced. So between, I think, like July until today, there has been 16 evacuation orders for Palestinians. So whenever people
that's just from July, by the way, I just want to emphasize, you said from July until today. So that's just the last month and a half, 2 months.
Yeah, exactly. So whenever you have this displaced population that settles down in some small corner of Gaza, they try to reach out to some of the aid organizations that are present. They try to have a modicum of organization. So in terms of like where to dispose of waste, how to like move around the sewage water, so it's not where people live and in their tents and whatever. All of this cannot be done, even the most basic of things, when you're being moved around 16 times in a month and a half. So yeah, this is definitely a promoter of diseases. Also, garbage disposal in Gaza has become very difficult. Back in the days before October 7th, they used to have designated spots to bury the waste, and it usually was around the border of Gaza, the land border of Gaza. Today, this land border is completely, it's basically like no man's land. Israel doesn't allow any Palestinian to even approach this border. So you have people living in tents with sewage running around them and inside their tents, garbage around, bodies decaying and decomposing all around, parasites, malnutrition, no access to medicine, no access to health services. So this is a nightmare that can and will always promote diseases anywhere across the world. If you replicate the same conditions anywhere, you will have outbreaks of very dangerous diseases.
And polio is basically the tip of the iceberg. I also wanted to ask about, okay, so I'm going to walk you through this piece this was published back in, let me see the date on it. I'm putting it up right now. This was published at the Century Foundation back in March. So March 2024, the title for those who are just listening is Gaza's health crisis doesn't respect borders. Israeli-Palestinian cooperation is critical for all. And it's written by someone called Dahlia Scheinlin. She, goes on to basically lay out how Israel cannot allow the Gaza's public health emergency to worsen because of the fact that they can't isolate any diseases that might break out from affecting Israelis as well, which very much you can explain if that's accurate or not. It sounds like it's probably accurate because I'm sure that disease outbreaks and the promotion of basically epidemics could actually be catastrophic, not just for the region, but actually for the world. If COVID taught us anything, it's that, right? But I think what's missing from something like this is the fact that Israel doesn't care because they are intentionally doing this. So I guess let me start with this. I guess first, can you explain, I know you already touched on it, but the reason cooperation can't work is because you basically broke down earlier that this is intentional. So can you talk a little bit about the intention behind Israel's basically going out of its way to create conditions for this and why that is the biggest obstacle to preventing this? And then perhaps we can move on to the fact that, yes, this will, in fact, if it hasn't already, impact Israelis on some levels because you cannot isolate or you cannot, prevent disease outbreaks from necessarily coming out of Gaza.
Mm-hmm. So first, let's start by differentiating one thing. So just because a policy is intentional does not mean that it is rational and smart. Mm. These are very different things. People can engage in policies that are also equally self-destructive. And this is exactly what Israel has done. There is something called international health regulations across the world. These are legally binding measures that countries have to abide by, and they have to do mostly with the spread of infectious diseases, and specifically diseases that have the potential of affecting other countries. Israel is a signatory, of course, to these regulations, like most of the world, and this is something that the WHO points out as well in its own report. And they said that the spread of polio in Gaza is not only a problem for Palestinians in Gaza, but also it is an international problem. It can easily become an international problem. And that is why the Israelis agreed to the vaccination campaign, because they absolutely do not have a choice. You cannot just release polio into the water system, and this water is going to go into the Mediterranean Sea. It's going to go into water reservoirs. You cannot just spread it around and hope for the best. You cannot have polio on the shores of Lebanon, Turkey, Greece, Italy, Spain, and even northern Africa, and expect people to be like, oh yeah, this is fine. You can continue doing this policy just because it is intentional. So no, it is definitely a problem, and this Israel is engaging in activities and policies that not only endanger Palestinians in Gaza and Palestinians also in the West Bank more recently, but also the entire world. And this is the definition of a rogue state, because they are endangering everybody around. So from that perspective, this is where we go into what is completely absurd. And that is that we know that Israel is promoting diseases. We know how they're doing it. We know that you cannot partly undo what has been done without an immediate cessation of the genocide in Gaza. However, they did this weird thing where they would be like, okay, we're going to have these very localized temporary truces for 3-4 days in specific areas that are going to move around across Gaza so we can vaccinate people against polio. And then, we'll just resume everything else. So it is definitely okay for Palestinians to be bombed, into dust, and you can't even identify the bodies. You have to put them in plastic bags. But if they die of polio, this is a problem, because this is a problem that is exported outside of the borders of Gaza. So this is how they went through this process. This is their mental process in a way. And we're living in a very perverse world, really, where some forms of death are allowed and encouraged, and others are no, because it affects other people. And if I may just say one thing as well about this vaccination campaign. So the WHO said that they brought in 1.2 million doses of vaccines because you have to take like 2 doses per person, and they aim to vaccinate 640,000 children across Gaza. But however, there's like a lot of tricky things that are going to be part of this campaign. So first of all, the most basic one is that it is difficult to understand, even for me, when I'm looking at the announcements of the vaccination campaign. Some of them are saying it's like between 6 and 3 p.m. Others are saying it's between 7:30 a.m. and 2 p.m.
Different times.
And some are saying some are saying it's for 3 days. Others are saying it's for 4 days. So this is a big problem, and you have they're gonna have these vaccination campaigns in 3 phases. So the first one is in the center of Gaza, then in the north, and in the south. And you only have these 3 or 4 days and these specific hours, or you miss out on the vaccine, which is already insane. And if I am a Palestinian, I would be absolutely terrified, having seen how Israel has systematically bombed every healthcare facility, didn't spare medical professionals, didn't spare patients, committed massacres within hospitals, and we've seen all of this. I mean, they would genuinely and legitimately be afraid of going there to get the vaccine to be able to protect their children, while being at a very real risk of getting killed by an Israeli raid. So, and as well, it's not organized. We don't understand exactly what is the time, because sometimes like half an hour can be the whole difference between somebody who's living like far away from this, from the locality where the vaccine is being administered, and all the dangers that happen across, while going there. Because the truth is not on the entire Gaza Strip; it is in very specific areas where the vaccines are being administered. And if you don't live in exactly in the vicinity of this area where the vaccine is being administered, you have a lot of challenges to make the journey to get this vaccine, and you might miss out on it completely.
It's incredible. So as long as you kill Palestinian babies with U.S. supplied bunker buster bombs and not polio, it's okay, because polio might affect everyone outside of Gaza. So you just want to kill them with things that can be isolated to Gaza. I mean, it's so disgusting and absurd. I wanted to ask, can you just elaborate a bit on we keep seeing polio paralyzes the limbs. This is not reversible, right? Like, tell me what happens if a 10-month-old, we learned a 10-month-old, 11-month-old contracted polio. So literally born into a genocide. Yeah. Okay. Yeah. So what does that mean for these kids who have it?
Yeah, so polio is not curable. Yeah, polio, the paralysis that's caused by polio is not curable. However, you can only protect against polio through the vaccine. This is the only treatment that we have. Otherwise, you have to live with disability for your entire life. And this is a huge problem, especially for people that live in poorer countries. And Gaza is even poorer than the poorest country. So it's usually like in other countries, like the more developed countries, they have like support, rehabilitation efforts, some kind of help, and usually it is more accessible to move around in these countries that cater towards the disabled. But otherwise, in countries, especially like let's say in areas like Gaza, the space itself is inaccessible. Even today, like with the rubble, you can't even walk. Like if you are fully able, what if you're paralyzed? This becomes a huge problem. And over time, this disability is not only a problem on the individual, but also on society as a whole. Because these people need constant help and support, especially in light of the lack of support that is given by health authorities, because they cannot afford to do that in Gaza. You're going to have the parents, the family members that constantly help you from the most basic needs, like getting food, preparing the food, getting dressed. And work can be done by some people, but not by others. And you have to like spend a lot of money on them, so they become a sort of like huge burden on themselves and on society all around them, and they cannot undo what has been done to them. And so in a way, this crime that is this outbreak, because this outbreak is not a fact of nature. It is not it is an active crime that was created by a bunch of people that are responsible for it. It's gonna the effect of this crime are gonna stretch out over time. It's not just an instantaneous problem, but it's gonna be a problem for life.
And this is also, I mean, you're talking about people being paralyzed for life, and this is in addition to so many disabilities that people in Gaza are going to have. I mean, yeah. I think this is like the highest number of child amputations. Oh, I lost you for a second. Oh. Are you there? Okay, you're back. There. Sorry, I'm just going to cut that out and then restart what I was saying. Mm-hmm. 24, 20. Cuts. Okay. So this is also in addition to so many other disabilities that are going to exist in Gaza after this genocide that already exist in Gaza. I believe, and you can correct me if I'm wrong on this or update me on the statistics here if you have them, Anis, but Gaza is now home to the highest number of child amputees in the world. So in addition to something like polio that's going to be paralyzing very small children for the rest of their lives, you have children having lost their legs, having lost their arms, fingers, parts of their faces. I mean, you see the images I do on social media that come across your screen sometimes where you're not even sure if this kid can survive this because like half their jaw is hanging off their face. I mean, the amount of injuries to children, to adults is so mind-bogglingly huge. And on top of that, you have the potential for so many diseases. You have the fact that people are basically starving. They're not drinking clean water. I mean, at this point, it's been 11 months of this. People's immune systems are completely shot. They don't have access to running water. They can't shower when they want or wash themselves. I mean, you don't even know where to start when it comes to public health in Gaza and what this is going to mean for the future. And I know this is a really big thing to ask of you, but could you maybe briefly surmise, let's say this ends tomorrow. That's not going to happen, but let's say this ends tomorrow. What kind of future are we looking at for Gaza when it comes to the quality of life people can possibly live when the quality of life was already so bad and then a genocide came?
Yeah. Well, it's a very difficult question because there's so much that has to be, so much has been undone and there is so much to redo, but with more difficulties. So we're going to start with the most basic things. So first of all, to clear the rubble in Gaza, it's going to take more than a decade. Let's start with this one first. And then there's the issue of housing, of rebuilding of infrastructure. If the siege is in place, will Israel allow the building material? And it has been known for more than a decade to stop, Gaza from accessing building material. So that's the first issue. Then this issue is compounded by the amount of bodies that are buried under the rubble. Excavating the rubble is one thing. If you have bodies in there, it's another. And there's, this estimate has been around like 10,000 people are under the rubble. There's also the issue of unexploded ordinances. So even when you're trying to excavate, you can't just like bulldoze everything because you might blow up some missile or bomb that is not unexploded, and you might kill the people who are trying to clear the rubble. That's like another issue. And you have the kids that are disabled are also exposed. They were even prior to October 7th. It was a very well-known threat for kids in Gaza to be exposed to these unexploded ordinances, and it used to cause like regular damage. So we can expect this to be far worse because we've seen like how much just the sheer volume of bombs that have been dropped on Gaza are insane. Then you have to rehabilitate everything. So from the water and sanitation infrastructure, from all the hospitals and the equipment that was damaged and the buildings that were destroyed, you also have to, we've seen the videos of universities and schools being bombed to dust. Nothing is left. These also will have to be rebuilt because education is a very important part of promoting good health practices. And then you also have to, there has to be an emergent inflow of aid. It's going to be very difficult to move this aid even within Gaza. So just because you get it, let's say, to Rafah or to the sea, to the coast, it's very difficult for this aid to circulate around Gaza because of all the rubble that is in the way. There are absolutely no roads. Houses will also have to be rebuilt. There's also a lot of work that will have to be done. First of all, to cure the people who are sick. Today, because the infections that are running around Gaza today are not just polio. There is scabies and lice and chickenpox and rashes and impetigo, diarrhea. We're talking about 2 million people that are sick, that are underfed. And finally, there's also the mental health aspect that has to be dealt with as well. Even prior to October 7th, it was an absolute disaster. It's heart wrenching when you read the statistics of mental health in Gaza. So there's like around and here talking strictly about children. 80% have mood disorders. This is depression and all that. 80% have anxiety disorders as well. 60% or 70% of parents also report that their children display something called akinetic mutism, and this is when a child is so under shock that they just sit there, do not move, and do not speak. And also 96% of adults suffer from depression. So Everybody has so many needs on so many levels as well.
It's hard to know where to even start. I mean, I saw this video of this girl. I mean, first of all, obviously there's like the more extreme videos. Like I mentioned, I'm sure like you've seen
Yeah,
that one video from a few months ago where like there was a child with, I don't even know if it was a boy or a girl, but their jaw was just like hanging off their face. So there's that. And that kid probably died. I don't know if that's
yeah.
survivable, especially in a place like Gaza where like you're really
Yeah, no,
limited.
no, complex surgeries are not survivable in Gaza. And even unfortunately, even the staff knows it, and they do. They engage in triage to be able to save those that are salvageable. And over time, the margin of what is a case that can be saved and what is decreasing and narrowing. Over time, and especially in light of the shortages of like anesthesia equipment, ICU equipment, even hospital beds. So like hospital beds, there used to be like around 3,500. Now there's like less than 1,500. So there is no room even to treat these people, and even not even the staff, because like there's around I think like 300 medical professionals that were killed. 181 of them are still, they were kidnapped by Israel. They're nowhere to be found. So and there's like 1,000 of them that were injured. So you
And there's,
can't
and
even if you want.
this is a place where like every day there's several mass casualty events, not like one,
Yes.
like several.
Yeah.
But so these are the more extreme things that we see, and it makes you not even pay attention to, because it's hard to they're not small things, they're actually big things, but they seem so much smaller in comparison. But I saw this video of this girl who looked like she was maybe like 7 or 8 years old, and her face was just completely scarred from shrapnel wounds. And she was saying in this video that, she used to love looking in the mirror. She used to like love looking in the mirror at her face because she thought her face was really beautiful. And now every time she looks in the mirror, she cries because she feels like she looks like a monster. So it's like, this is what we're talking about. Like, this is what we're looking at for people who haven't necessarily had their limbs amputated or died, but they've got these scars. And it's just that level of destruction of like children's psyches. I don't know if it's ever fixable. I mean, just the wholesale destruction of an entire society with no end in sight. And there's just no safety. On top of that, there's no end to it. Like you're just these kids, these adults, everyone in Gaza is just constantly in like hyper vigilant survival mode. And like at some point, that we've already passed. Sorry, go ahead.
Yeah, but it's not just because of even though the genocide is horrific. Even these things were also very highly problematic before October 7th. So in July 2023, there was a Save the Children report that documented children that were arrested or kidnapped by Israel to being sexually abused, beaten. So like they would be kidnapped from their homes in the middle of the night, and you had like 86% of them that said they were beaten. 70% were strip searched kids. This is a form of sexual abuse. Others were held in solitary confinement for periods that lasted between 1 and 48 days. So even without the war, the living under an occupation is destructive to the psyche of people who live under it or even around it. You don't even have to experience this violence firsthand to be psychologically affected by it. The stories are enough. When the worry of you maybe being one of these future victims is enough to break the mind of a human being.
Yeah. Well, I mean, that was one thing that was suspected about the Israelis using rape as a weapon in these torture dungeons they've created since October 7th. And then specifically releasing people who'd been subjected to these gang rapes so they could go tell people. Because it's terrifying.
And it happened before. Yeah, but it also happened before October 7th. Right. That's the thing. So like this Save the Children report that I cited earlier was published in July 2023. So this was before October 7th.
Yeah, everything's just intensified. Everything's just intensified on a wider scale. But yeah, they were already doing all of this, and it's just completely horrific. And then there's another aspect of this. Real quick, I just want to make this analogy because I think it's a completely apt analogy. I'm a big fan of analogies when it comes to this because Palestinians have been so dehumanized. Sometimes the only way to get people to recognize how horrific what's happening is to analogize it to a time and period where they actually do have empathy for the victims of something. But this polio vaccination, as important as it is, it's essentially like going into like Auschwitz in the midst of the Holocaust and being like, well, we're not going to stop the death camp, but we're going to go in and vaccinate everybody so that they don't cause a problem for the rest of the world.
Yeah, and knowing that they are all condemned to die. Yes, knowing that they all condemned to die, you have to die from these causes, but not the other causes.
Yeah, because these causes are a threat. Yeah, these causes are a threat to everyone else. It's really sickening. That said, about the vaccination campaign, I think this is like quite interesting. You were telling me earlier about the fact that it has ignited some anti-vaccine sentiment among some people in Gaza. And I'm curious if you can explain that like where that's coming from. I mean, I can suspect where it might be coming from, but yeah, how this whole entire situation, in fact, risks that for the population that does need to be vaccinated.
Yeah, so this is definitely an issue today, but it is multifactorial. First of all, I completely understand when Palestinians, like when they record themselves saying they have absolutely no trust in humanitarian organizations, they don't trust anybody or anything that is outside of Palestine, because they have truly been let down by everybody. No exception. All the governments, all the international institutions have shown how void, all this panache is when it comes to stopping a genocide. So this I completely understand. However, what is problematic is when you see that Israeli narratives promoting the same thing. They were basically encouraging Palestinians not to take the vaccine. For example, some of them have claimed that this is an experimental vaccine and it's new and it's not supposed to be used because it's also not only going to affect Palestinians but also Israelis. This is completely false. The vaccine that is being used today is a vaccine against the type 2 variant that is being given to Palestinians. It's been used multiple times before since 2018 until today, and it is very concerning when you see somebody who is advocating for your genocide also telling you do not take the vaccine. This is already insane. However, there's also, I think, the third issue, and that is a big issue that has to be dealt with globally, not just in the case of Palestine. There is a loss of trust in international scientific organizations. And this is not, denying this problem will not make it go away. Shaming people, calling them anti-vaxxers will not resolve the issue of trust.
If you enjoyed this episode and want to hear the rest, you can access it by becoming a Breakthrough News member at patreon.com/breakthroughnews.